Hello, my name is Dr. Jose Luis Ruiz, and I'm the director of the Los Angeles Institute of Clinical Dentistry. This video is a veneer preparation in less than 5 minutes, which is what I usually do in my practice. The armamentarium we use is a 6850014 burr from Brasler, which is in our LA Institute burr kit. I like to use less armamentarium to keep life easy. This diamond, in the middle of the diamond is 1 millimeter thickness. At the tip is, at the end is 1.4, at the very tip is 0.8. So this is a taper diamond, coarse diamond. We're gonna do 1 millimeter reduction. So in the middle of the diamond, we're gonna make a full depth all the way in, giving us a 1 millimeter reduction. Then we're gonna join those reductions, those depth cuts together so we can achieve a pretty predictable 1 millimeter reduction on the incisal edge, which is what we like. We are very conservative in our preparations. Something that I find to be very useful is using two hands when moving the burr. When you see one hand, it's a little shaky. When you put the second finger of your other hand, you gain tremendous stability. I learned this from Gordon Christensen. Now, right there you see I'm marking, putting an imaginary line where the gum would be, because our goal is to prep two gum line, not touch the gums. Of course, this is a Typodont, so the gums have been badly damaged with so much use over the years. I'm doing depth cuts, sinking the diamond halfway in. That diamond at the tip, as I mentioned before, is 0.8 of a millimeter. So when I sink it halfway, I am achieving a 0.4 reduction. Now I'm joining the depth cuts, as you see. And as I do that, I'm developing a chamfer that is 0.4 again of millimeter in that. The goal is to stay not much more than that, to try to have enamel in that cervical reduction. Of course, in that part of the tooth, we know the enamel is very, very thin. So if we go too deep, too much more than that, we're gonna get into dentin, and we want to avoid that as much as we can. It's not the end of the world if you hit the dentin a little bit. Then we are, continuing to carry that reduction after finishing that cervical area. I like to bring the reduction interproximally, the same amount of reduction interproximally, maybe a tiny bit deeper. My goal is to go halfway into the proximal area. So the next thing that we're going to do is, of course, the middle reduction of the tooth. And sometimes I like to just double check and maybe do a tiny bit of refinement here and there. So now we're going to do the middle of the facial surface reduction, which should be approximately 0.5 or 0.6 millimeters. That means that we're going to be sinking our diamond more than halfway in. So if it's 0.6 or 0.5 or a little bit lower, it's a little bit more, it's not really the end of the world. So we're trying to approximate. Those are very, very small amounts. Now, as you can see, I made the depth cuts, confirmed that they are that appropriate depth. Now I'm going to start erasing them. And as you saw, I'm changing the angle of the diamond as I'm doing this. So very quickly, I can erase those depth cuts and be comfortable that I have done the correct amount of reduction pretty accurately. From that point, I'm going to go ahead and do an incisal edge beveling, or basically getting rid of that sharp line angle. Make sure you make it disappear completely, as you see right there. The next thing I'm going to do is make sure that distal incisal corner is removed, the mesial incisal corner is removed. I could use my Softflex disc to do that as well, the coarse one. I want to show you now how to confirm that you did the correct amount of cervical preparation, about 0.4 of a millimeter, half of the depth of the burr. You can see reconfirmation right there. The final thing would be to get rid of those J margins, the lip on the preparation using a metal strip on both sides. And my friends, that's it. That's a 5-minute preparation. Usually has how long it takes. Thank you for your time.